Good afternoon. My name is Mark Gaselli. I am a past president of the Greater New York chapter and currently serve as the student committee chairman. It is my great pleasure to introduce our next lecturer, Sheila Hautbois. Sheila is a physician assistant who sees patients at Morris Cardiovascular and Risk Reduction Center in Chester, Virginia. Her practice is outpatient cardiology with special emphasis on disease reversal and prevention, using the 6 pillars of lifestyle medicine, which includes exercise. Sheila offers regular new patient and follow-up visits, personal lifestyle medicine consults, and shared medical meetings. Sheila is also adjunct faculty at Shenandoah University PA program and serves as a preceptor for nurse practitioner and PA students from several programs. She is the current chair of the American College of Lifestyle Medicine PA Member Interest Group and is an active member of the ACLM Cardiology Member Interest Group and the ACLM Fitness and Medicine Member Interest Group. She also serves as the PA spokesperson for the Park RX America. Her lecture today will be Ideas and Strategies, How Exercise Professionals Can Team Up with Healthcare Providers. We are now pleased to present Sheila Hautbois.
Hello and welcome to this presentation, Ideas and Strategies, How Exercise Professionals Can Team Up with Healthcare Providers. I am Sheila Hautbois, a board-certified physician assistant with a master's in public health and my certified health education specialist. I am super excited to be working with the American College of Sports Medicine Greater New York Regional Chapter to bring you a healthcare provider's perspective on bridging the gap between medicine and fitness. I have no financial relationships to report, no sponsorships, no conflicts of interest, and no disclosures. The objectives for my talk today are to define which prescribers to approach regarding collaboration, to describe shared medical appointments, which are a huge opportunity for collaboration between fitness and medicine, and to discuss additional opportunities for teaming up with healthcare providers. It's important to talk about the terminology of who you would want to collaborate with. So a little bit interchangeable are the terms healthcare provider, practitioner, or prescriber. But essentially when I use those terms, I'm talking about physicians, including MDs and DOs, and advanced practice providers, APPs, those are PAs and NPs, physician assistants and nurse practitioners. Essentially, this is important because these healthcare providers can bill insurance. We are credentialed and licensed. So we are the billers and we can collaborate with you to provide certain services to patients that can be billed to the patient's insurance. Now, if you're interested in the difference between a PA and an NP, both have master's or doctoral degrees. PAs are generally trained in the medical model. It's about a 3-year medical school program and includes a year of clinical rotations in different practices. And the scope of practice is as wide as our MD team allows us. It's determined at the practice level. And PAs can shift or move to other specialties throughout our career. So we could start out in internal medicine and then move to cardiology and then move to urology and OBGYN or whatever, because we've been trained in each of those throughout our education. Nurse practitioners are nurses first, and then they expand their education and specialize in one area. So there are geriatric nurse practitioners, pediatric nurse practitioners, adult nurse practitioners, and perhaps 1 or 2 more. There are some differences in practice between PAs and NPs, but from your point of view as a fitness or exercise professional, essentially we're the same and should be thought of as influential people in a practice and strong potential referral sources or collaborators. Generally, we have received more education about the importance of exercise and health behaviors and the importance of these on a patient's health. Patient care experience is a prerequisite for PA programs. Actually, there's quite a few exercise science majors who go on to PA school. Plus, we have all had undergraduate coursework in microbiology, chemistry, biochemistry, psychology, and statistics. And then, of course, the medical education and the clinical rotations. And those usually include emergency medicine, general surgery, hospital medicine, pediatrics, women's health, and an elective. Most PA programs include a cadaver lab experience. And then PAs sit for a comprehensive national board certification exam and have to recertify every 10 years. So I'm sure that's more than you wanted to know, but I felt it was important to describe the different healthcare providers that you will be coming into contact with. Powerful language you can use when you communicate with healthcare providers are words such as team up, collaborate, or improve patient outcomes. That last one is important because Medicare and some other insurances have an incentive program whereby reimbursement is partially affected by results as a whole. For instance, annual reporting of all diabetic patients in the practice and how the overall A1C has changed that year can result in a penalty or a bonus for a provider, especially in primary care. So there are incentives for primary care practitioners to improve patient health. In November of 2020, just last fall, the U.S. Preventive Services Task Force, also known as USPSTF, released an updated recommendation regarding behavioral counseling to prevent cardiovascular disease in adults. The recommendation states that healthcare providers should offer or refer individuals 18 years or older with known cardiovascular disease risk factors, for example, hypertension or elevated blood pressure or dyslipidemia, to behavioral counseling interventions to promote a healthy diet and physical activity. So this is now an official recommendation, and healthcare providers should be following that in order to be providing best practice. So where do you find healthcare providers with whom to team? You can look at the American College of Lifestyle Medicine. Most providers who are listed in there are already going to be gung-ho about exercise and fitness because that is one of the pillars of lifestyle medicine. The website Exercises Medicine has a page where providers can sign a petition saying they're going to talk about exercise with their patients. I'm not sure if a database is kept of that, but any providers who advertise the Exercises Medicine logo on their website would also be providers who are open to an emphasis on exercise for their patients. Any provider that does the Walk with a Doc program would be another one. That's often done by a PA in the practice, even though the program name is not inclusive, and that's just because it was started by an MD. Certain types of providers may be more open to collaborating with an exercise specialist, and that would include primary care providers, also known as PCPs, and that includes primary care providers who are now doing their own direct primary care, and that acronym is DPC. Bariatric practices, you might think that's just bariatric surgery. However, there is a major effort before bariatric surgery of trying to assist patients with weight loss, and there are often exercise specialists involved in those programs. Ortho loves to collaborate and increase results for patients because a lot of times they cannot proceed with a knee, hip, shoulder surgery if the patient's BMI is over a certain number. It's too risky. And cardiology practices are very much into increasing exercise and fitness for our patients. So now for the next few slides, I want to discuss with you a big opportunity, which is shared medical appointments. On the left is a picture of a shared medical appointment I did on stress management. I brought in a guest MD to do an experiential meditation with the group. And the group here is patients and a household member or neighbor or guest. I have done different topics over the last few years, including nutrition, stress, sleep, and exercise topics. And my exercise topics included yoga, balance and fall prevention, and stretching. On the right, you will see the picture of my stretching shared medical appointment, where it was experiential. We had mats down in the room, and the patients were guided in different stretches that they could do at home safely. I talked in each case about the benefits of the specific type of exercise on the heart, since I'm in a cardiology practice, and then the exercise professional led the group demonstration. I've had yoga instructors come, personal trainers, a senior student in an athletic training program who did a fall prevention program for me. So even students can get involved in teaming up with a healthcare provider to do things like this. This is a win because patients love it. It's a win because providers love it, because many visits are billed at the same time, making it a financially beneficial visit with only 4 to 6 patients needed to break even for the provider's time. The format for a shared medical appointment is pretty straightforward. The total time is typically an hour to an hour and a half. The medical assistant does the medication reconciliation and a history update and gets vitals on the patient pretty quickly in just a few minutes. And then the provider, the healthcare provider or billing provider, does a review of systems and a brief physical exam. Those components are currently necessary in order to bill a regular visit. The shared medical appointment can be a one-time thing, or it can even be a series, like a weekly series for a specific topic, perhaps diabetes or weight loss. The setting does need to be the provider's actual practice location or a virtual setting now in COVID, that the laws and insurances are allowing that. But it cannot be a gym, a library, a park down the street, anything like that. It needs to be a location on record for that provider with the insurance. These shared medical appointments are billed as a regular E&M code. That's a regular office visit, in essence, a 99213 or a 99214 if you want to speak provider language. If it's a virtual visit, the provider just adds a 95 modifier onto that code that indicates it's virtual, and you decide between the codes based on the complexity of the patient and the physical exam components. So usually in a group setting, it's 99213, but if the provider is able to do a little bit more of a physical exam, or the patients are a little bit more complicated, such as in a specialty practice, they may be able to bill 99214s for each patient. The documentation rules are changing in 2021 for providers. The rules seem to be more focused on time and allowing some time-based coding, so the billing might change, but for now, this is what it has been. The provider would document ICD-10 billing codes based on the patient's problems that we also call comorbidities. There is a code for sedentary, and there's also a code for fitness education. So those can be used for the exercise shared medical appointments. And as I said on a previous slide, usually the break-even point is about 6 patients for a shared medical appointment in primary care setting or billing 99213, and it is less if you're able to bill 99214. And then the fitness professional or exercise person would either talk for free in exchange for being able to hand out business cards and promote your own services, or you might charge a flat fee to the provider because the provider is going to be billing multiple patient visits and benefiting from you being there as far as marketing and increasing the number of patients coming to that visit. Some of the ways that myself and other people have advertised these shared medical appointments include posting on our practice's social media website, sending patient portal messages to patients with specific diagnoses in their chart, posting signs in our lobby or in our exam rooms. The exam rooms are a particularly effective place to put a sign because usually a patient is in there waiting for quite a few minutes before seeing a provider, and they are looking around at everything on the wall. Other types of advertising can include the practice website, the radio, the local newspaper, and flyers in other medical practices. So for instance, primary care providers in the area, if you're a specialty practice and you're offering these types of shared medical appointments. Shared medical appointments are for established patients, not new patients. So the patient would need to have had another visit in the practice before coming to the shared medical appointment. The benefits to the patient include social support because there are other people in this shared medical appointment, and there's a dynamic that happens with that where the patients can be of support to each other and realize that they're not alone in their conditions. Patients also get exposure to fitness with the exercise-focused shared medical appointments. and maybe some fitness things that they haven't tried. They get longer visit times with a provider, and there are definite increases in patient satisfaction. Providers get benefits as well. Referrals increase always. So referrals to the exercise provider and also referrals from the guests that the patients bring with them. And then there's efficiency of time. So instead of someone like myself having to go from room to room and give the same information to a multitude of patients, I can just provide that information in one setting with multiple patients there and bill for all of those different patient visits. So in summary, regarding shared medical appointments, this is a great opportunity for collaboration and teamwork. It is a win-win-win for patients, healthcare providers, and fitness professionals. For the provider, it's a wonderful way to see patients more efficiently, bundled with others who need the same patient education in less time, increase revenue for the practice, and feel really good about what you're doing. Providers can invite an exercise specialist to do the presentation part of the group meeting. The provider does the brief physical exam and ensures that the vitals and the review of systems are charted, and then the provider bills a visit for each patient to the patient's insurance. Shared medical appointments are a great way for fitness professionals to collaborate with MDs, DOs, PAs, and NP providers. Two really good resources on shared medical appointments are the Lifestyle Medicine Shared Medical Appointment Toolkit through the American College of Lifestyle Medicine at lifestylemedicine.org. And that's a toolkit, an article, a fillable marketing flyer, a sample consent form, and a complimentary webinar. You access it in the members only section by scrolling down and clicking the LMSMA resources. And Dr. Shilpa Saxena has written an article called Leveraging Time with Lifestyle-Based Group Visits, and she's got a slides program that's free online at the Cleveland Heart Lab website there that I've posted. I would definitely recommend looking at these, and I would recommend that all students join the American College of Lifestyle Medicine. It is very inexpensive to join as a student, and there are a plethora of resources on that website that will be useful for you. In addition to shared medical appointments, there are other collaboration opportunities with healthcare providers that include providing fitness counseling, medical fitness, getting involved with Walk with a Doc, helping to co-sponsor or be a vendor at a local 5K or other physical activity event, and providing healthcare provider education. One great service that exercise specialists can provide is fitness counseling at an office visit. So the healthcare provider can involve the fitness specialist and bring them in to part of the visit and then bill for the total visit time. My EPC would come in and do this in the room while I finished charting and sending the patient prescriptions. And the total time, their time and my time, was added up because their time is considered incident to my time. They're working as underneath me, so the whole total time is what's billed to the insurance. And it is very appropriate to bill time-based billing. Basically, the exercise professional does their assessment and writes the exercise prescription for patients who are interested. And it's a win-win-win for all three parties, the providers, the exercise professionals, and the patients. You may be fortunate enough to find a provider's office that has a room in the office or clinic for active exercise sessions. I have a dedicated gym room in my office. We also have used the space for shared medical appointments, for health movie night, for healthy food tasting, and other events before COVID, and we're hoping to be able to get back to those soon. Some providers are located in a building with a fitness facility, and that also works because it's the same physical address. Here is a picture of the fitness room in my office. Patients feel comfortable working out in our office knowing that their cardiology team and a crash cart is in the house. This is a picture of a fit camp program. Here's an example of personal training going on in the same fitness room in my practice. Here is an example of Zumba going on in the same fitness room in my practice. Now, these fit camp, Zumba, and personal training are basically going straight through the exercise professional. So these are not shared medical appointments, although you could do a Zumba shared medical appointment, for example. But in this case, I'm talking about just offering fitness to the patients in the facility with an exercise provider. For providers who do not have space available for medical fitness, they would need to refer out to an exercise professional. So do introduce yourself to local healthcare providers. If you have space elsewhere, you could offer to bring coffee or a lunch and meet with the provider in their office. We love coffee and lunch brought to us and are very familiar with that model from the pharmaceutical companies. So when a different healthcare provider or some other provider who might benefit our patients offers to do that, we always oblige. You can also offer a free consultation at your location, preferably at a time when you're finishing up with one of your other clients so that the provider can see how you interact with your clients. When you do meet with the healthcare provider, ask them about the most common complaints and diagnoses that they see in their practice. Share success stories of your clients, especially of any who have those complaints or diagnoses. Mention your education and your experience, especially with those complaints and diagnoses, and definitely explain the benefits of a supervised progressive exercise program. Most healthcare providers are very familiar with the Move More philosophy, but many are not familiar with progressive exercise and its extra benefits. Walk with a Doc is a national program designed to get patients out walking with their healthcare provider. Usually this happens on weekends or evenings, and there's the website. These are some pictures from a walk that the physician in my practice and I did with patients and friends before COVID. On the left is a big table we had set up at the meeting spot at the park, and on the right is the physician I work with our empty pills container, which is at the front door right inside the lobby of our practice. So we have an emphasis on changing your lifestyle, and when we help you to do that and you get off of a medication, you bring it in and we have a ceremony where you dunk it into the container and we keep all those empty pill containers as a great visual when you enter the practice. That's me in the blue t-shirt on the right there, and we have patients, families, and friends. This is the Riverwalk in Hautbois, Virginia on a Sunday afternoon. Another opportunity for collaboration would be to come together as a vendor or sponsor for a 5K locally or another health event in the community. So we have a banner for our practice and had set up a table here at the community 5K, and there are some pictures from that. So you could team up with the healthcare provider to have a booth or be a sponsor so that both of your names would be on the official t-shirt and the event materials, and you could have some business cards and brochures about your fitness at that table. One last thing I would ask you to consider is to help healthcare providers improve our education as far as physical activity. Teach providers about the physical activity vital sign and encourage providers to use it. Even medical assistants can easily do this, ask these questions of the patient before the provider even enters the room, so it will not need to take any more time. Then the provider would see the result in the chart, and that would increase opportunity for fitness referrals. Also teach providers about progressive exercise, what it means and the importance of it and the benefits. I have a confession to make. Although I get it now, for years I was in the camp of just encouraging more exercise than someone's baseline. And I was happy when they did more today than they did yesterday. It has only been in the last 5 years since getting involved with the American College of Lifestyle Medicine that I have grown to understand so much more about exercise and the principles of exercise science. Recently, I had the wonderful opportunity to co-author a chapter in a Lifestyle Medicine for Advanced Practice Providers textbook, along with a kinesiologist. And even throughout the process of writing that chapter, I learned more about exercise science than I had understood before. So there is a big opportunity to offer healthcare providers education in exercise. And the more that healthcare providers are educated in this, the more referrals will happen and the more collaboration will happen. I want to end with this quote by Thomas Edison. "The doctor of the future will give no medicine, but will instruct his patients in care of the human frame, in diet, and in the cause and prevention of disease. In my medical training program, one day we had a psychiatrist who came to guest lecture for a few hours and presented cases of different psychiatric conditions. At the end of his several hours lecture, when he asked if there were any questions, no one else had any, but I raised my hand. I had to ask. You have illustrated for us a variety of psychiatric conditions and all of the medications that we can use to treat them. How would exercise affect psychiatric conditions? I will never forget his reply. If all of my patients would participate in regular exercise, then 90% of them would likely not need me at all, and I could focus on providing more thorough care to the 10% who do, as well as being able to see new patients faster. There was a silence in the room, and none of the students could really understand what had just been said. Nobody said anything. We kind of all just gathered our things, cheered for him, thanked him for the lecture, and he walked out, and we walked out in a daze. But that stuck with me, and to this day, I will never forget it. I bring up exercise with every single patient I see. I talked about exercise at each patient visit. I not only try to encourage each patient to increase their exercise, but to also make progress with it and to get help with progressing their exercise routine. I know this is not standard. It's not something every provider takes time to do. It's not something every provider has time to do or thinks they have time to do. But it's so very important because exercise is so important. I strongly believe that exercise is medicine, and I know you do too. That's why you're attending this conference. So the quote really kind of boils down the essence of this basic message. And in my mind, exercise is even more powerful than any drug. I often say that if we could put it in a pill, it would be the most prescribed medication on the face of the earth. Thank you for your attention today. If you have any questions, I have placed my contact information below. Again, I'm a PA. I work in cardiology in Virginia. I have my master's in public health, and I'm also a certified health education specialist. There's my email and my website. I truly hope you've enjoyed today's presentation and that it will stimulate some ideas for collaboration between fitness providers and healthcare providers.